Meanwhile, he is preparing for his first presentation. I'd like to give all my thanks to Professor Abdullah Bafail, the Vice President for Projects, as well as Dr. Ayman Fadil, Dean Faculty of Economics and Administration, who is also the Director of Prince Mqrin Chair for Crisis and Disaster Management. What we're going to do for this hour, we will have almost like 25 minutes for the presentation of the first speaker, and then like 5 minutes discussion, and then we will move to the next presentation for another 25 minutes and 5 minutes for discussion, and then that will be the closing remarks afterwards.
Thank you, Mr. Chairman. Good afternoon, ladies and gentlemen. So, the title of my presentation is Mass Casualty Management, Disasters Dealing with Mass Gatherings such as Al-Hajj pilgrimage. I feel a little bit uncomfortable because I am talking about Al-Hajj here in Saudi Arabia, whereas you know much better than me, but I would like to share some of my findings, some of my experiences about mass gatherings, which might be useful for you for future plan projects or interventions, so that you can reduce the casualty or injuries or any other type of disasters. And before I begin, I would like to express my kind gratitude and sincere thanks to King Abdulaziz University, Honorable Vice President Professor Dr. Abdullah Omar, and Dean Professor Dr. Fadil, and other dignitaries, and of course Dr. Harold Drager, because he is the architect of this workshop, I guess. So he has been so kind to me and to others as well. So this was really a very good experience to me, and this is my first time to Saudi Arabia. And actually I have a lot of contents here, but I have only 30-35 slides, so I hope I can finish. So this is the table of content. Some of them I may skip if we'll have not enough time. So here I would like to quote UN Secretary General Ban Ki-moon. He has told that disaster risk is increasing with every passing day. Poverty, rapid urbanization, climate change, these and other factors are leaving people and communities ever more exposed. So it shows how disasters are serious and important, and we should take into account. And the Global Assessment Report on Disaster Risk Reduction also has mentioned that $1 trillion have been lost in the last decade due to disasters, and 1 million people killed. So it shows the gravity of the loss due to disasters in various parts of the world. And particularly the losses are occurring in Asian continent, and in Asian continent also in South Asia, particularly Bangladesh, Nepal, India, Pakistan and other countries. So this is the number of disasters since 1900 to 2010 all over the world. We can see the sharp rise of this graph from 1900 to 2010. There are various reasons for being so sharp rise. It's because of media reporting, because of the population pressure, because of rapid urbanization, and because of environmental degradation, and nowadays due to climate change, and there are so many reasons. And the trend is like this. You see, the number of disasters and the number of affected people is in increasing trend. It's increasing day by day. Because as I mentioned briefly, because of population pressure and rapid urbanization and environmental degradation, and basically in third world countries. However, we can reduce the impact of disasters by preparing ourselves and our infrastructures. And disasters are becoming more costly because we have to invest quite a lot. And poor countries are much more affected because they have the lack of resources, and they have the lack of human as well as material resources. That is very important. And you see, we are living in such a miserable condition. People travel like this. They are highly vulnerable to any kind of disaster. You see, if nothing happens, it's okay, but if anything happens, then many people will be killed. So this kind of risk we are taking in some part of the world. And this is the picture from Nepal. You see, they travel in a vehicle like this, taking the risk of their life. And you see, we built the road, but we are not sometimes not been able to blacktop it, and then the vehicle driver, they have to face the accident. So we cannot avoid hazards. Hazards are, you see, natural phenomena, but we can reduce their impact by adopting various preparedness and mitigative measures like public awareness raising, constructing dikes, dams, and other things. So now I will focus on Hajj. Actually, talking about Hajj here, as I mentioned earlier in the beginning, that is like showing torch to the sun. So I apologize if I have misquoted something here. So, but what we mean by mass gatherings is that it has actually a unique feature and behavior that pose risk to the population around and the concerned authorities. That is a matter of concern, particularly to the person in the authorities, basically to the security personnel, and also this is the concern for the community around, because they will be impacted in case of any disaster or mishaps. And mass gatherings is usually organized as well as sometimes unorganized and unplanned. It happens all of a sudden. For example, if there is any political rally all of a sudden organized, then the person in the authorities will not be informed in due time, and then they will have a hard time to manage, hard time to control the mob. And actually the political parties, when they gather together and they take their supporters together, and sometimes they become violent, and when they meet the two opponents, two different political parties, if they collapse each other or meet each other, then unfortunate events occur from time to time. That kind of situation is really very difficult to handle. We have experienced many times in the past. Maybe that is not a big problem here, but in a country like ours, you see, it's really a big challenge, and we have casualties and injuries in a big number. And in the case of disaster, it exceeds the response capability of the affected community or nation hosting the event, and requires medical services for large population, like during the Hajj here. You have people from more than 150, 60 countries, and you will really have a very big challenge. And many people may have health problems. That is very common during mass gatherings. Even if the people are strong and stout and healthy, they may have problem during mass gatherings because of the environment. And basically, children, women, disabled, and elderly people will have a higher rate of fatality or illness, because they have less capability of. And here are some definitions. The first is from Emergency Management Agency of Australia. They have defined mass gatherings is an event associated with the congregation of large numbers of people gathered together in a single place for a particular purpose. And the World Health Organization has defined as any event, either organized or spontaneous, that attracts sufficient number of people to strengthen the planning and response resources of the community, city, or nation hosting the event. Both definitions are quite similar, and actually mass gatherings is a situation, or it's an event during which crowds gather and where there is potential for delayed response to emergencies because of limited access or other features of the environment and location. And later on I will show you some historical events where we can see various reasons for disasters. And we have various types of events, and yesterday also our Right Honorable Mayor from Makkah, I believe, yeah, he also talked much about Hajj, so he has presented very beautiful pictures and very important data and information that what kind of situation may arise during such mass gatherings like the Hajj. So besides sporting events like a World Cup, Football World Cup and Olympics, or Cricket World Cup, and social events like music concerts or bands, air shows, and jamborees, and also public funeral. Sometimes if high dignitary is dead, and then his supporters or followers may gather together, and there may be some kind of incident, unfortunately. And religious events like the Hajj, and there are other events like that in various parts of the world. In India also there is one event called Kumbh Mela, which occurs every year, but in 12 years time they have very long program for a period of 1 month, and millions of people gather there, and a lot of incidents occur there during that time. I will also show you a brief information about that. And political assemblies, I mentioned earlier that some political parties, they all of a sudden announce the gatherings, and they create the problems. And usually in that situation, you see the political party assembly sometimes are very undisciplined, and they don't hear anybody. They don't hear the security personnel, they don't hear the leaders, they don't hear anybody, and they do whatever they like. And that is really very unfortunate. And procession and protests, protests also are undisciplined sometimes. People vandalize and displaced people internally or externally due to disasters or due to political situation or conflict. It can happen. So here is a rough categorization of mass gatherings. So if the number of people is above 200, we can consider it as mass gatherings. And major mass gatherings 100,000 to 250,000, super mass gatherings 250 to 500,000, and extreme mass gathering is above 500,000 to 1 million, and mega mass gathering like Hajj is more than 1 million. For example, as presented by the Right Honorable Mayor, 2.5 million were gathered during the Hajj in Mecca last year. And there were 70 million visitors in Shanghai Expo some years ago. It's quite a large number. So these are the main issues during mass gatherings. You see, when there is mass gatherings and in a small place or sometimes in a confined location, and if the infrastructure facility is not adequate enough, or if the infrastructures are weak or poor, then we may have a lot of problems. And the problems such as respiratory, facial, oral, vector-borne diseases, zoonotic, and so on and so forth. This kind of problem may occur, health problem. And regarding the transportation problem is very common in big gatherings because the public transportations are overwhelmed, and the amplified risks of food, water, and waste disposal also is a very big problem, particularly in an environment in which infrastructure is inadequate or inappropriate. Because particularly in poor countries, they have poor infrastructure and inadequate, and a lot of problem arises there. And there is also the amplified public health risk during and after mass gathering. The impact of health remains even after the mass gathering. So these are the types of illness people may face during the mass gatherings. Traumatic situations, headaches and minor medical problems, asthma and hyperventilation, drug and alcohol complications. Fortunately, it is a very good thing to learn that here these things are banned. So you are lucky, and actually all the people are lucky, but in a country like ours, you see, drug and use of alcohol and sometimes lethal weapons is a very big problem. If you go to Nepal, you see, maybe you cannot buy the buy Coca-Cola, but you can easily buy alcohol even in a small shop. So that is really very bad. And hyperthermia and psychiatric problems, diabetes, epilepsy. People sometimes they do faint, and animal bites or insect stings. I don't know what is the situation here, but in some countries like even in Nepal and India and Pakistan, you see, some people they take animals to demonstrate, to show the people to collect a small amount of money, and sometimes the animals they become hostile and they injure the people, and sometimes they kill. You see, because they go sometimes with a lion or tiger or elephant or monkey or cobra snake. So anything can happen. So these are the risks associated with mass gatherings, which we have to take into consideration. During the air show, even the airplane may fall down and may cause injury, and it has happened in the past in some places. And in parade also, and rock concerts, people get excited, and sometimes they are undisciplined and they are volatile and they fight each other, or they, if they are unhappy with the celebrity, they also try to attack him or her. So that kind of thing may happen, and the security personnel will have a hard time. And similarly, visit of celebrities and VIPs also, because there will be a lot of people, so it will be difficult to manage, to make the gathering disciplined. And dehydration is always there if safe drinking water is not available. And temperature extremes, if the temperature is too hot or too cold, in both situations it is difficult to cope. And the risks of mass crowd movement and human stampede, I will show you the examples of stampede. There are so many stampede incidents. And failure of infrastructure, if the infrastructure is not well built, is weak, or if many people that the infrastructure can bear go there, then casualty will certainly occur. And large crowds as a highly visible target, and specific religious or cultural events like Hajj and Kumbh Mela, all these things. And this is the core problem in mass gatherings. Like mass gatherings events have an enormous impact and severe pressure on the local health care system, and a mixture of high crowd density, limited or difficult points of access, lack of fire safety, difficulty in controlling the crowd, and lack of on-site medical care that can lead to problems that results into disaster. So the location and the facilities are very, very important in controlling the mass crowd or in managing the mass gatherings. So mass gatherings are hazardous events that may suddenly turn into disaster, causing enormous loss of human lives and physical properties. Past events have shown this. And now I will talk a little bit about Hajj. I don't need to say, but I will just read out. You know it better than I do. This is one of the largest mass gathering in the world, and it occurs every year. I know, and about 160 to 187 countries. Maybe last year there were 187. That takes place each year in Mecca and other parts of Western Saudi Arabia. And it is a ritual that is intended to promote the Islamic brotherhood and sisterhood by showing that everyone is equal in the eye of Allah. Despite of religious values and significance of the Hajj pilgrimage, there are some issues and challenges of health hazard and security and exposure to potential disasters such as stampede, which occurred many times in the past. But now I think you are doing well, I hope. And it is indeed a very big logistic challenge to the royal government of Saudi Arabia. And from the resource materials, I have learned that now we have improved quite a lot. And since 1950s, Saudi government has spent more than $100 billion for the improvement of the facilities for the benefit of the pilgrims, which is a very good news. So your economy supports allows, but not the economy of developing countries like this. So in India, during the Kumbh Mela, they have really a very hard time, tough time, and a lot of criticism to the government. And methodology of this study was qualitative and quantitative data, and actually I visited websites and collected some literatures written about the Hajj and the mass gathering incidents of from 1971 to 2000 were identified and analyzed through literature and web search. And literatures and articles containing information related to mass gathering also were reviewed. So this is the main source of this presentation. I also have provided a brief paper, you can have a look. So here you can see this mass gathering during Al-Hajj. This is an aerial view of August 6, 2012. So there are so many people. Another picture. And this is very old picture from 1934. That time there were not, I think this is not during the Hajj, but the place is different than at present. You see here, you can see the high-rise towers. Here you don't see that much. And this is, I guess, prayer time. Pilgrims pray outside the Grand Mosque in Mecca. And here is a series of events. You see, in 1981, there was the Stardust fire in Dublin. 48 people died and 128 people were injured. In 1985, the Bradford Football Stadium fire occurred due to a discarded cigarette. A careless person threw the butt of the cigarette and caused 56 deaths and 200 injuries. And in 1988, 71 people died. It was in Nepal, you see, in Kathmandu. There was football stadium, the football match was going on. All of a sudden, the weather was not that good, and there was a windstorm, hailstorm and lightning, and people got afraid and they ran away out of the stadium, and the exit points were not well managed, well organized, or they were too narrow, and people rushed all at a time, and 71 people died and hundreds others were injured in 1988. And in 1989, 95 people died and more than 400 were injured in Hillsborough Football Stadium due to crowd rush. And in 1990, during the Hajj in Mecca, a stampede caused the death of 1,426 deaths and hundreds were injured due to single exit point. Now I guess you have improved this situation. And again in 1994, 270 pilgrims were killed due to stampede at the stoning of the devil ritual. And in 1998, 118 pilgrims were trampled to death and 180 injured in an incident on Jamarat Bridge because the bridge was narrow and many people were crossing each other. And in 1998, 63 died and 213 injured in Gothenburg discotheque. So it was overcapacitated and there was this incident. And in 2003 in Toronto in Canada, many people had physical and mental problems, but there is no data of death and injury, but they had a severe health problem. And in 2004, at an Indian wedding ceremony, 441 people died because they had the tent, cotton tent, and the tents were caught by fire and so many people died. So we must have a fireproof tent if possible. In 2001, 35 pilgrims were killed due to the stampede during the stoning of the devil ritual, again in Mecca. And in 2003, 14 pilgrims died during stoning of the devil ritual. 2004, 251 pilgrims were killed and 244 injured in a stampede during the stoning of ritual in Mina. And in 2006, 346 died, injuring hundreds others in a cross during the stone throwing ritual at the Hajj pilgrimage in Mecca. In 2010, during a law parade in Germany, overcrowding occurred in a tunnel due to single entrance and exit. So many people were impacted. So this is not actually the complete list, and I have put many more data from the Hajj pilgrimage because the topics was related to Hajj. So this is just a glimpse of this kind of events. There are many more events like this in this period. And we have to learn lessons from the past events, and we have to improve the infrastructure and other facilities to reduce the casualties, injuries, and other losses, including property loss. So now, in 2013, during Mahakumbh Mela in India, you see there was a stampede in the railway station, and 36 people died and 39 injured. But this kind of incident during Mahakumbh Mela goes on there because it lasts for more than 1 month. And in 2030, again in Mecca, 3.5 million pilgrims were registered for Hajj pilgrimage. Among them, 1.7 million were from 187 different countries, and there were also unregistered cohorts So despite tireless efforts and management by the Saudi government, many people had health and injury problems. I don't have the data. If there is not any, then that is good news. So I just put this figure for your information. So this is the key planning issue we have to take into account to cope with this kind of mass gathering hazards. And these 5 areas should be considered, should be taken into account. Overcrowding, we have to identify what kind of gathering it is, and how are the event access points, entry and exit points, and how are the fire safety measures, and how well we are prepared medically. These things are very important, and also emergency response. Even if there is any kind of event or disaster, then how efficiently we respond, that is very important. And these are some pictures you see from this football stadium and this fire hazard and other things. So this is very important to know, particularly to the disaster managers and the security personnel, that how is the venue, how is the entry and exit, how are the entry and exit points, and how many participants it can or visitors it can accommodate, and how easy it is for the emergency vehicles to enter into, and whether the venue is easily accessible to the disabled persons or not. And for security also, in the event of disaster, it will be difficult to go to carry out the response work. So that thing also should be taken into account. And we have to consider how is the fencing and how is the design, if it is inside or outside. So these things are very important. And if it is in a stadium or in a hall, we should know the capacity, capability and the strength of that particular infrastructure. If the infrastructure is weak and there is overcrowding, then any kind of disaster may occur, may happen. And we also should look into the environmental aspects, like whether it is indoor or outdoor, it is in a shade or whether it is in the shade and shelter or not. And we also we must see whether how is the terrain, whether it is a hilly region or flat area, or what kind of site is that, and remoteness. If there is no road network, or if it is not easily accessible, then in the event of a disaster it will be very difficult to carry out rescue and relief works. I will show you one picture regarding this. And whether there are single or multiple venues, or how is the lighting and power. All these things are very important. If the lighting and power is not reliable and adequate enough, then if it is evening or night time, then the casualty and injuries may rise significantly. So, and we have to first of all assess the nature of the event. It is pre-planned or spontaneous. If it is spontaneous, then we will have hard time. The management will be more difficult, I mentioned earlier also. And the specific risks associated with some events like vehicle racing, all of a sudden anything can happen. People cannot think of it. You see, if whether it is a car or motorbike, it can all of a sudden cross the bar and come and hit to the people. So that kind of incident occur from time to time. And if it is in night time, as I mentioned earlier, it will be more difficult to manage. If it is in daylight time, then it will be much easier. And also the length of the event matters, how long it takes place. So I told you that the Mahakumbh Mela in India, it occurs for a period of more than 1 month. So the security personnel and disaster managers always have headache and hard time. And whether it is localized or dispersed, the Mahakumbh Mela, it is kind of dispersed. They go in different places. They confine in a single place. There is a particular place, but they also go to some other places, and it is difficult to manage. And people have, you see, sometimes risk-taking behavior. Like for example, during the stunt, if there is a stunt man or woman and people go to see there, and if they are close by, then the stunt man or woman can hit them by mistake, because they sometimes approach too close. And we have to see how is the environment, how is the weather. As I mentioned earlier, is it too hot, too cold, or so that also matters. And whether there is a risk of fire and flood, risk of fire, risk of flood or not. And pests, large animals, as I mentioned you earlier, and poisonous snakes and other things, plants, and the terrain, and access to other resources, and use of drugs and lethal weapons, I mentioned earlier, and there may be the traumatic situation. So here you can see the risk-taking behavior. On the left here you see this is a religious place, and people are climbing like this, and elderly people and children, women, and sometimes disabled people also try to go there, and they may fall down, and they may die, or they may have injuries and other health problems. And here you see this is Kumbh Mela, and people are taking bath in this Ganga river, and people, those who cannot swim and are not used to go into the water, they may be drowned and may be killed. So, and it happens every time. And this is a political assembly. So, as I mentioned earlier, that sometimes if even if the political leader says something wrong, or says something that these spectators don't like, then they start throwing stone to the leader, and the leader's supporters will go against them, and they fight each other, and anything can happen. You see, that kind of situation occurs from time to time in India and in our country as well. So this will be really very difficult to manage, and this is really very bad incident from time to time. And we have to also look into the nature of the crowd, and we have to consider the predictability of the number of the people, how many people are there, so that we can manage accordingly. And we have to consider the age and health situation of the crowd. If there are quite a big number of children and elderly people, then we should manage accordingly. Because in political rallies in South Asia, you see sometimes the political parties, they call upon the small school children to show the large number of their supporters, which is very bad. And any kind of disaster may happen, may occur, and it has occurred in the past. And we have to look into the mood and behavior of the crowd, what kind of crowd it is. If it is political, then we should be much more cautious, because they can start vandalism at any time, and they have done so in the past many times. We have a lot of experiences. And we have to see the density of the crowd. If they are in a big number and they are all together, not dispersed, then it will be difficult to manage. And whether the crowd is seated or mobile also matters, and whether they follow the directions or the guidance or not, that also matters. Therefore, the clarity and receptivity of communication and public announcements are very, very important. And this kind of communication or announcements should be easily visible and easily audible, so that they can hear and they can follow and they obey them. So this is one of the picture of Kumbh Mela in India. So the situation of health services, first aid is of course prime importance, and we must have a fixed as well as mobile service for health services, and medical aid posts should be there, and paramedics should be there, doctors, nurses, and other support personnel should be there, and emergency retrieval and triage. Of course, we have to identify in case of mass casualty, we have to triage them. We have to identify the dead people, seriously injured people, and lightly injured people. And lightly injured people can be the source of help to treat the seriously injured people. So that kind of management we have to carry out. And stabilization and transfer, if they cannot be treated on the field, then we have to transfer to them to the hospital or some other medical facilities. And cooperation and collaboration among public health event organizer and other agencies is highly necessary. They have to cooperate, they have to work in good harmony among each other, otherwise there will be another chaos. And safety of health personnel is also of prime importance. If the health personnel, they are not safe, and if they don't feel safe, then they will not go and treat the injured person. So that is also very important. And we must have adequate resources and appropriate logistics without which we cannot treat the injured people. So here are some basic and very simple recommendations that the lessons we have learned from the past events clearly indicate that most disasters had similar features, and therefore by learning lessons from those past events we can improve the situation and we can reduce the casualty and other losses. So disaster managers actually should consider during the time of planning for a mass gathering, and it is actually very necessary to sit together, and maybe we do it, and sit together and plan ahead of time and debrief after finishing the event that what kind of mistakes were taken and what kind of improvement are necessary. So that will help to reduce the hazard in the days to come. So briefing, data collection, reporting, patient follow-up, multi-agency coordination, situational awareness, intelligence and debriefing are necessary steps. We must do it from time to time, before and after the event. And on-site medical care and water, sanitation and hygiene facilities is a prerequisite for the mass gatherings like Hajj and Kumbh Mela, where millions of people gather. And adequate numbers of access points. I mentioned repeatedly that exit point and entry point should be sufficient and should be convenient. And if possible, there should be separate entry and exit point for health personnel and security personnel. And for mass gatherings, terrorism risk assessment also is necessary, particularly for some countries, because even in the Olympic Games there was a terrorist attack long ago, so that kind of incident might happen, so we have to consider this aspect as well. And risk analysis, development of health plan, resources allocation, health command and control system should be carried out. And here are actually some standard guidelines which we can find in the website of World Health Organization, and we can get a lot of invaluable information from here. Similarly, Emergency Management Authority of Australia also has their own website from where we can download a lot of useful information. And here are some manuals and guidelines which we can find. These are, just for example, these are some event management guidelines. So you can copy or download and get information from here in order to manage the mass gatherings more efficiently and effectively. So I would like to conclude by saying that sufficient planning, preparation and organization minimizes the disaster risk, and health and safety of participants should be a prime concern. As I mentioned earlier, if the health personnel will not feel safe and they hesitate to go there, then the victims will be helpless. So that is very important. And taking care the health of people at all times, because we, as I mentioned earlier, we must have mobile health service, mobile hospital, and also fixed. So the mobile one, they can go around and they can check the health situation of the mass and act accordingly. And we have to respond effectively immediately after a disaster if it happens all of a sudden. And if considered carefully in planning for mass gatherings, this might reduce morbidity and mortality in case of a disaster. And organizers should comply with the health standards. I showed you some links and some books from where we can get information and data, and we can gather some idea and we can act accordingly. So every mass gatherings event should have a major incident and mass casualty plan, including the evacuation plan. I guess you have here, and in many cases in our part of the world we don't have. They just gather in an unexpected place and create a lot of problem, which should be activated in the event of a disaster. So planning is very important, very necessary. And actually disaster management is a multidisciplinary act, and it cannot be handled by a single agency or single person. It is a joint effort. So nothing is precious than human life. Prevention is better than cure. We all know it. And actually there is a thought on leadership that individual, not the system, make a difference. Even if we have very good legislation, if the implementation is poor, implementation is not effective, then it doesn't work. In our country we have very good legislations, but people don't follow. Even the top politicians, policy makers, bureaucrats, they don't follow, and people actually like to break the law, which is not good. Thank you very much.
Thank you.
This is all from my side.
Thank you very much, Dr. Shetri. Now we'll open the floor for discussion, please. We have time actually for only 2 questions, if possible. So that any questions? While you are thinking of any of the questions, I'd like just to raise suggestions of, from our experience, heat stroke, especially in the summertime during pilgrimage, is quite an important issue, and we have to have a lot of considerations for it. Also, from another point is that, burns, even though it's not that common, thank God, these days, but still, if it happens, that we have to be ready. And I know from statistics, according to the number of beds that we have in the Kingdom of Saudi Arabia is very limited. It's not at the level of expectations if anything happened less than Allah. This is one of the points that I'd like to raise, and also, things like coronavirus, which is happening now. It's, epidemics of all kinds that may happen, and we were so much worried last year during the pilgrimage time where Corona was in the rise, and thank God that everything was, contained without having any problems. Another comment of, do you have in your universities or schools, do you teach all students for first aid, management, and basic life support? Because this is probably, if we consider like a small mini curriculum of 1 credit hour or so for all the university students, if they can have 1 credit hour of basic life support, which is going to help everybody, not only for medical students, but for all university students, as well as first aid management.
I forgot to mention one thing in the recommendation, that actually mock drills, simulation exercises are very, very important to manage the mass gathering as well. And as you rightly mentioned, that we can do it from the school level. We can educate, we can train the school students accordingly. Actually, in Japan, to cope with the earthquake disasters, they educate the students from the primary level, and they are used to, you see, in the event of an earthquake, they can easily escape or be on the safe side. So similarly, to cope with mass gatherings also, we can educate, we can train from the childhood, so that they will be well aware of ahead of time. That I forgot to mention, to include in the recommendation. Thank you.
Okay, any questions from there? The ladies' side, yes?
السلام عليكم. أشكركم على التنظيم وعلى أوراق العمل المقدمة. هي ملاحظة وليست سؤال، يعني بنيتها من عدة حضور لملتقيات في الجامعة. أتمنى تطوير الترجمة لأنها ترجمة متقطعة، تقريبا بعضها يكون حرفي. حرام إن أوراق العمل ما نطلع بالفائدة المرجوة، إضافة إلى احترام المستمع بعدم الأكل أو الشرب والتثاؤب خلال الترجمة. شاكرة لكم جهودكم والله يوفقكم.
Okay, well, really again, another point just to raise is the volunteers and database for volunteers and blood donations, that we may also keep in mind for data gathering, especially. I guess because of time, we'd like to introduce our second speaker, whom I know from before, who started with us at the Faculty of Medicine at the University Hospital, Dr. Carol Taylor, who is the Executive Director of Fraser Institute for Health and Risk Analytics, and he's the former Director and CEO of CDAR Global. He's going to talk about the bugs, barriers, and borders, challenges, and solutions to health risk preparedness. So I'd like to welcome Mr. Taylor for his presentation.
Thank you very much, Doctor, and thank you very much. I want to say one thing before I start, and that is, I speak at a lot of conferences. In fact, I'm leaving here to go speak at a medical conference over the weekend back in the United States. And I must say, I can't think of any place that I've ever spoken and any conference I've attended where the hosts have been more gracious and more kind and more willing to share their stories and so much of your community. So I just want to thank you, and I certainly want to thank teams. It's clear that when they organize a conference, they do a wonderful job, and when they pick venues and titles, they do a wonderful job, and it certainly has been a great experience for me. It's my first time here in Saudi Arabia. It's been a wonderful experience, and I'm grateful for all that you have shared with me. I've learned a lot this week, and it's been wonderful. I've got lessons I can take back and share, and I want to close, I think, our portion of the presentations with a discussion about uncertainty. Now, maybe when I get to the end of it, we'll have a little window into how to gain some certainty, but I want to talk about uncertainty. And I want to talk about uncertainty in the context of pandemics. In particular, as you know, for the past 2 or 3 years, you've been wrestling with this unique coronavirus. And you mentioned it earlier. And so I want to talk a little bit about it because viruses are difficult. One of the reasons that we have a tough time in dealing with viruses is, first of all, we can't see them. You know, they're not something tangible. If you have a sandstorm coming, you have a weather report and a visual experience of this sandstorm. You have a history and a recollection of what sandstorms do. You have a history of preparedness of what to do when a sandstorm comes. Likewise, in the United States, when we have hurricanes. We have hurricane warnings, we have maps, we have charts, we have an ability to track the storms, and even though occasionally they're a bit wrong, we can visually see the storm with our eyes, not so with a virus. And in particular, when the virus is a unique, novel virus, something that we have not dealt with before, then it adds to the concern, it adds to the fear, it adds to the worry about what is happening and what we should be doing. And viruses, consequently, particularly unique and novel viruses like coronaviruses, cause uncertainty. And we as humans, as one of the many things that we have in common with each other, is we don't like uncertainty. We like certainty from experience and certainty of direction and certainty of knowledge, and viruses give us an uncertainty. Part of that uncertainty is, in many cases, we don't know initially where they come from. Now, to be fair, even after we know, and I'll talk about this a little bit more, the decisions become difficult, but early on, we don't know. We can certainly talk about, does it come from bats? Is it like a coronavirus where it comes from camels, perhaps? Is it from migrating fowl or from poultry, or is it swine related to swine flu? We don't know where this bug is coming. We know now suddenly it's become present with us. We're observing something different in our country or in our cities or in our hospitals, but now we're trying to back up and say, well, what's driving this? Is it something that perhaps a pilgrim brought with them to our country, or is it something, in fact, that we have here in Saudi Arabia, and if so, from where? We worry, even when we know that it's an outbreak in the animals, whether or not that virus, in fact, will attain something called a spillover. It's that moment in time when a virus decides it is fully capable of leaving its animal host and migrating into a human being as its next host. It's that migration that becomes uncertain. It's not only uncertain as to the migration, but it becomes uncertain in how effective that virus is going to be once it leaves its animal host and moves into us. Will we be efficient transmitters of that disease, or will we be inefficient transmitters? We've been perhaps a bit lucky with MERS as a coronavirus that it's been a little more difficult to spread from human to human than perhaps its cousin SARS, which found traction through a series of super spreaders and was able to spread more rapidly and more quickly. That shouldn't give us a lot of comfort, frankly, because there's still uncertainty, because viruses go through changes. But there are some certainties where we may be uncertain of this novel virus. We may be uncertain of where it's coming from. We may be uncertain of its early abilities to infect us. There are 7 certainties, I believe, that we can bank on. One is very clearly that it doesn't matter where you are in the world, you are certainly susceptible to a virus. Very few places, if anywhere, like the Kingdom of Saudi Arabia, invites more people to your country for purposes of visiting. So it does not matter that, for example, Ebola is not endemic and found naturally in Saudi Arabia. Dallas, Texas did not expect to have an Ebola victim. That was evidenced by the fact that when, in fact, he first presented to the hospital, they misdiagnosed him and sent him back home. He later presented and died in the hospital. Dallas, Texas didn't expect it. I was with Andrea Zanon last year in France, in Marseille, and literally there had just been the first case of MERS, the coronavirus, from here in Indianapolis, Indiana. Indianapolis did not expect to be at risk from MERS because obviously it's in the United States. So consequently, people ask me, how fast will a virus spread? How fast will a virus travel? And my answer is always about 500 miles an hour, because that's how fast a jet will go carrying someone who may be infected. So one of the certainties is that there is a need and a reason to maintain a global surveillance of diseases and outbreaks that are prevalent, because at some point in time, as long as you have an airport, they may be near you. The second, and this sort of ties onto a question that came up earlier this morning, and that is that in many cases what we have found is that outbreaks are every bit as much an economic event as they are a health event. SARS at the end of the day only killed, and I say only with quotes, only killed about 800 people, but it literally cratered for a moment in time the economy of Hong Kong. Certainly took a significant bite out of the economy of Toronto as conventions canceled. Nobody wanted to be in Toronto. Even Dallas, Texas, the hospital that had the one Ebola patient, suffered a significant economic downturn as patients didn't want to deliver, expectant mothers didn't want to deliver their babies at Dallas Presbyterian Hospital because it had become the Ebola hospital in Dallas, Texas, even after the Ebola victim had passed on. Outbreaks are economic issues, and you have to deal with them as a whole society, as a whole community approach, and I'm going to show you a model in a little bit about why that matters, but outbreaks are economic. The third is, and I always say that viruses are more nimble than your disaster plan, and here's what I mean by this. If you've worked a sandstorm after a sandstorm, if you've worked in the trauma center after a difficult trauma collision, fatality between a truck and a bus, if you've worked in an emergency room after a hurricane, or if you've deployed to Haiti after an earthquake, for the most part, the event is behind you. You're now dealing with the healthcare issues from that event. But one of the interesting things about hurricanes is once hurricanes pass, the sun comes back out. Once a sandstorm passes, the sun comes back out, and so we can deliver care, but in the comfort that we're delivering care because the threat has passed us. Not so, not so in a virus. There is so much credit due to King Abdulaziz Hospital here that as many patients as you've treated with the coronavirus with MERS, that your staff have not become infected. That is not the norm by any stretch of the imagination. Most frequently what happens is that those who are in the front lines of delivering care are the next ones to become infected with the virus. What happens when that occurs is that the entire sort of infrastructure that your caregivers rely on begin to disappear. If you have any doubt about that, read some of the testimony from the nurses during the SARS outbreak in Toronto. If you were a nurse working in a hospital with a SARS patient, the schools told you not to bring your children to school the next day. If you were a nurse working in a hospital with a SARS outbreak, your daycare center would not see your children. If you were a nurse working in a hospital with an Ebola outbreak, chances are that your husband, your mother, your father, or your grandchild took the children and left Toronto and said, "We don't want them in the same house when you come home to work." I had a nurse one time tell me as we were preparing for a pandemic influenza, H5N1, come up to me and she said, "I want you to know that the minute we know that we have the first case in the hospital, I'm not coming to work the next day." And I said, "What do you mean? It's your duty. You're supposed to come to work." And she said, "There's a nursing shortage in the United States. I can work anywhere. I am not going to put myself in harm's way." Viruses create fear, even in caregivers. Fear is never your friend. So there's a certainty that you've got to manage the management of an outbreak, of a pandemic, of a virus, always with an eye toward, how's my staff doing? Do they feel that I'm telling them the truth? Do they feel like that I'm protecting their health care? Do we have adequate PPE training? Do they feel safe when they come to work? The next thing that you have to do, and I say this cautiously, is that sometimes you have to ignore the experts. I always find this rather humorous, and I invite you as you go forward. It's interesting to me that every time a new novel virus is announced, there's this whole fleet of suddenly minute experts that want to tell you all about the virus, of course, as long as you pay them. It was interesting to me, and I was on a CDC panel a couple of weeks ago, and I was a bit of a critic, to be fair. You probably now, those of you that know me know that's not a surprise. But the CDC modeling for the Ebola epidemic was was somewhere north of 1 million cases. It was that moment in time when the CDC experts wanted to sort of get to the front pages of the newspaper. Now, you could argue that's because they wanted to make the public aware of the event. That might be true. But if you kind of want a little humor in this, I invite you to Google. There's a YouTube in which a British kind of comedian downloaded all of the US newscasts about Ebola and then downloaded all the British newscasts about Ebola. And the US newscasts were, Ebola, the killer virus is here, we're all going to die. I mean, it was sort of like that, our typical sort of American media, it's awful, get ready, it's horrible, don't let anybody come to our shores, this is it. At the same time, at the same day on the British news was, that's no big deal. Ebola won't really do all that well in England. Why do we really care about it? I don't even understand why people are talking about it. It's a West African problem. If you want to go help in West Africa, go. Yes, I think that's a good idea. But if you think the UK should be worried, why? I don't understand it. So 2 countries separated by an ocean dealing with the same issues, but one is really hyper-plugging the event. I have my own reasons for that, which I'll leave. And one country is radically downplaying the event. I urge caution. We are a country that likes to buy stuff. And so whenever there's a promise of something like Tamiflu, just buy several million doses of Tamiflu because everybody needs it, despite the fact that even at that time there was evidence out there that Tamiflu probably wouldn't make any difference with an H5N1 virus. So there's an interesting need to be able, with medical professionals, to distill the difference between good advice and, self-serving advice, because experts will be wrong. That's not to say, to be quite candid, that you don't have to come up with a message. And this is very important. It's very important. Tom Frieden, the head of CDC, said something that, again, I wasn't sure I would agree with. I certainly wouldn't have said it. But just after the Dallas Presbyterian Hospital and where the gentleman died, Tom Frieden went on TV and said, I will have you know that every hospital in America is prepared to deal with Ebola. Now, how many people believe that's a true statement? Show of hands? Yeah, me neither. I spent a long time training hospitals, and that's not true. Now, yes, we bought a lot of PPE suits, but we don't have a lot of experience in the United States in dealing with Ebola. We just don't. And so it wouldn't be a surprise to me that there weren't mistakes made, as there were at Texas Presbyterian, which is a good hospital, by the way, that there weren't mistakes made because we don't have familiarity in dealing with Ebola. But what's important is the community wants to believe that you have expertise. They're going to want to believe that the College of Medicine has all the answers. They're going to want to believe that the hospital has all the answers. They're going to want to believe that the Ministry of Health has all the answers. They're going to want to believe that Civil Defense has all the answers, because they're going to want to believe that you know something about this novel virus that they don't know. And if you don't, and if you don't, they're going to come up with their own answers. In the absence of good instruction from you, your public will find the way. In Guangzhou, during the early outbreak of SARS, the information about SARS was very slow to come out of China. People knew they had SARS. They knew they had something. The Chinese originally identified SARS or published that it was an atypical pneumonia. Why? Well, because we're used to atypical pneumonia. It may be atypical, but it's pneumonia. We're comfortable with it. We understand what it is, but it wasn't atypical pneumonia. The citizens knew it wasn't atypical pneumonia. And they actually began buying vinegar because they believe vinegar, of course, has antiviral, antibacterial property. And the price of vinegar literally went up 1,000% because the public believed that they had to go find their own solutions because they weren't sure they were getting good solutions early on from the people that they should be trusting for solutions. So one of the things that has to happen, and it's very difficult, very difficult, is that you've got to take an uncertain situation, but you've got to translate that uncertainty to your public in a way that causes them to act in a direction you want them to act. Do you want schools to close? Do you want not to shop at the mall? Do you want to, the most difficult decisions that we had to make during H5N1, interestingly enough, weren't clinical decisions. The most difficult decisions we had to make were really economic decisions. Do you or don't you close schools? That's it sounds so easy, right? Because children are these great spreaders of disease. But as soon as you close schools, you lose probably 25% of your workforce because their parents can't get to work because now they've got to stay home and take care of the children. That's not trivial. I said Tuesday, and this may not resonate, but one of the things we would never do is cancel a pro football game. Football is so important in life that, it would really have to be a significant outbreak before we would ever cancel a football game. But it's very difficult. The decisions with the public. Do you impact your economy? There was a lot of criticism in the UK during the second sort of hoof and mouth disease where they started this huge culling of herds, and it killed the entire tourist season of the UK. There's a lot of criticism that action that they took was wrong, and unfortunately what happened was the people that were preparing to visit the UK during that summer chose not to go. And so the good, solid advice somehow got lost in the shuffle, and the public made their own decision. That was, we're not going to England as vacationers this year. So you must make decisions. Teddy Roosevelt, who was a president of the United States, said the best decision to make is the right one. The second best decision to make is the wrong one. The worst one is don't do anything. So you've got to make a decision. So I want to talk about how we make decisions. How do we take uncertainty and make it more certain? And I'm going to begin with this because Andrea Zamon at the World Bank a few months ago said, could you come up with an economic model? My company is mostly actuaries and insurance professionals. Could you come up with an economic model that could begin to sort of set the stage for a dialogue? And this is where Andrea was 100% correct. Andrea said that one of the ways to begin a discussion about preparedness is really to begin at the Ministry of Finance level. Remember what I said earlier, right? That in many cases, outbreaks are economic events, and that the economic impact far exceeds the medical impact. And Andrea is very wise because he said, I know that's true, so I want to talk about a way to get in front of the ministers of finance to convince them that outbreaks and pandemic preparedness pays. And so we came up with a model. The bracket, by the way, is still missing. We have filled it in the real model, by the way. And, but it was proof that Andrea was reading the model. And so we came up with a model that basically says, look, here's what we're trying to do. Let's take a particular disease or outbreak, and those outbreaks or diseases are going to have certain characteristics. One that we don't talk a lot about is, has it been named? It's really interesting. When you give a virus a name, the virus becomes scary. You ever notice that? If you just call it a coronavirus, it's really interesting. Some of the wonderful marketing is, well, coronavirus, that's what a cold is. So a cold, I'm not really worried about that. But when you give it Middle Eastern Respiratory Syndrome, and then you immediately say, it's really in that same family as SARS, right? And SARS death, and MERS cousin related, immediately as soon as you name something, you've got a real problem. I think, just leave it as a virus. It's a virus, we're wrestling with it, we know what it is. But as immediately you name it, and then the question is, the two big things about viruses, of course, are how lethal is it, and how quickly can it be infected? How much can I transmit it to you? So it's really the RO rate, which is mortality and infectivity. And so you've got to take that and say, what's the mortality and what's the infectivity rate? How many people are going to get sick and how many people are going to die? Against that backdrop, then, there are a series of economic considerations. One is, what's the cost of treatment? Second is, what's the cost of intervention? There's some interesting dialogue about the development of immunizations or not developing immunizations. What's the cost of intervention? What's the cost of treatment? But against those trade-offs of spending money on intervention and treatment, what is this disease likely to drive in terms of overall economic outbreak? What happens if we have a drop in the number of pilgrims that come? What happens if we have a drop in the number of workers that want to be here? What happens if we have an impact to our oil industry or to other things, to our, what happens and what's the cost of that impact. And that cost of that impact related to the disease is mitigated by the amount of money you spend on preparedness. And I really encourage you to move forward with models like this as a way to have a dialogue. Because what you're trying to do is really get to the second part that Andrea's working on, that he really presented, I think, yesterday in his talk. And it's what Carl calls 4 pillars, and Andrea does it much better than I do. But Carl's 4 pillars are, the very first thing you want to do is you want to sense the presence of an outbreak as early as possible. If your first notice of an outbreak is when you're actually seeing a patient in the hospital, you've actually lost. Because by the time a patient gets to the hospital, chances are they've already infected a number of other people. Chances are that spillover has already occurred from some other vector. The chance to truly interrupt the disease early has been lost, and so you want the ability to sense the presence of a novel virus as early as possible, because it is much easier to intervene early than deal with the problems late, as we're seeing now with West Africa and Ebola. If you want to take a look, watch Hans Rosling's TED Talk or presentation of March, I think the 23rd, in which literally one victim of Ebola actually infected 43 other people. After he had already sort of declared victory on the disease, by the way, which is nowhere near over. And so one of the things you want to do is sense. The second thing you want to do is modeling. I'll talk a little bit more about this in a slide. And then what we want to do from that is we want to have some ability for decision support, because we want right action. In the middle of uncertainty, we want to do the right things because the public is counting on us to do the right thing, and then you have to get humans engaged. So let me just talk briefly about this. When I talk about sensing, I'm not just talking about the biosensing awareness. That I know you've got a presence in, and I think that makes sense. If hospitals are reporting, I think that makes a great deal of sense through your reporting network. But it may be that the first indication of an outbreak may be coming from, from your cattle herds. It may be coming from somebody that deals with poultry. It may be dealing with somebody that actually deals with livestock. It may actually be the teachers in your schools that notice a higher rate of absence. It may be flight crews that are coming back home sick. How did SARS get to Mongolia? It got to Mongolia with flight crews that were going home, bringing SARS with them when they went home. And so the early warning sensing is not just what happens in the hospital. It's not just that disease reporting system after the fact, if you will, but it's very much reaching out into your community much more broadly to be able to acquire information. With that information, then, you need to begin to develop, and this is a wonderful project for this university, is to begin to develop the ability to model what the disease is going to be. Remember, we're talking about translating this disease into how many deaths, how effective is it going to be, what's the future of this disease against the response. If I were to ask you right now that you could eliminate MERS, but you had to eliminate every camel in the Kingdom of Saudi Arabia, would you anticipate some pushback from the population? Yeah, probably, right? And so what you want to do is find that balance of right action, and models will allow you to do this. This is a model I built several years ago for an insurance company, and it was around H5N1, and they asked a very simple question. They said, we have life insurance policies in force and effect all over the United States. H5N1 now is coming to our shores. How many of our policyholders are going to die, and should we worry about it? So I built a model, and I literally sort of ingested the entire census of the United States into this model. And then I built attributes of the RO rates, of mortality and infectivity, and then I ran some sort of simulations about infectivity, and we came up with a range of what I would call the minimum loss and the maximum loss. And I was invited down to Sea Island, Georgia, with all of the senior leadership of this life insurance company. They were from the Northeast, but they had gone to Georgia, this private sort of enclave, locked everybody else out, and I walked in, and they expected me to walk in with really bad news, because they were getting ready to say, all right, how many billions of dollars in losses are we going to have? So I walked in and said, well, look, here's what the model looks like. Here's your minimum losses against this scenario. Here's the maximum losses. And they're all going, oh, well, what do you think is going to be minimum or maximum? And I said, I'm going to tell you it's actually going to be under the minimum, because I believe H5N1 is not really our problem. And they all went, that's not what our experts are telling us. And I said, experts are always wrong. And I said, I'm going to tell you it's really not a problem. Well, it turned out I was right. I was grateful for that. I'm not always right, but I was right about H5N1. But the important part was, by running that model, it allowed them to see what are the ranges? And against those ranges, if you track the disease, if it in fact it had taken hold in the U.S. more prolifically, then they could have begun to have taken steps on their own to mitigate the overall exposed loss with their insurance policy. Next, and this is probably for another full day at some point in time, but all of us, when dealing with uncertainty, all of us, when dealing with a novel virus that creates fear and uncertainty, that has the ability to kill or to create significant illness, all of us want to make the right decisions. None of us want to tell our public, our patients, or those that entrust in us the wrong thing to do. And so you've got to develop an ability to take the facts as they're coming in, to take what is known and unknown, to be able to distill through those and get back down to what is it we're really trying to accomplish? What is it we're trying to protect? What are we trying to drive as our real outcomes? And then when you get down to the bottom of my little decision support, on the right-hand side, you will see something called human and social. And that is when we finally decide that we're going to take this action, that we're going to respond this way, that we believe that this is going to deliver the right action. When you get down to the last side, you still have to have humans to carry out what you want it to do. And back to what I said a little bit earlier, outbreaks are interesting things because the caregivers themselves are at risk, as much risk of becoming ill as the patients themselves. And so you have to really distill down to, we know exactly what we want to do, but now how do we encourage, how do we track, and how do we support the humans who at the end of the day have to actually undertake the actions? I love Mean's final slide in which it said individuals, not systems. And when you're dealing with highly infectious diseases, it's really about training, empowering, and supporting the individual at the bedside to make the right decision in terms of how to care for those patients. So this is really an old slide from Instead, which you may not recall, but it's really about what we're trying to accomplish. We're trying to use the 4 pillars. We're trying to have adequate sensing. We're trying to really use what I call sort of good modeling and good decision support, all the things that Andrea's working on at the World Bank, with right action to get to one point where we have a collective action that we agree is correct that's going to drive outcomes. And I'm going to just close with this is why it's important. This is a picture from West Point, Liberia. It is ground zero for the Ebola outbreak. I have to tell you a little story behind this picture. The people behind the gate there are Ebola victims. They have Ebola, and they're an Ebola hospital/holding facility. The people on the outside are people who believe that the Ebola victims are getting too much. They're being treated too well. They're getting things that the people on the outside don't have. And so this entire riot that ensues out in front of this Ebola hospital is over this mattress. Can you see the mattress that's there? It's over. The entire fight, the entire riot is because Ebola victims are being given mattresses. Now I want you to look at that picture very clearly and very carefully. Of the blood and the urine from the Ebola victims on that mattress that now the crowd wants to steal. There are several billion, if not several trillion, Ebola viruses on that mattress. I cannot imagine any circumstance ever in my life in which I would have valued that mattress. Now, the only person in this picture that makes any sense to me, anybody want to guess who it is? Yeah, it's a young girl looking back, because she's the only one that says, this doesn't make any sense to me. We're rioting here to steal this mattress from this Ebola patient to carry it out, and all we're really going to do is what? We're going to spread Ebola out to the very people that have caused this riot. And I'll tell you what I read into this picture, and I'll tell you what she's looking for. She's looking for somebody that actually has the right, correct action, that has the right ability to say, no, don't do this, that has an ability to say, do you understand that the risk of harm to steal this mattress will kill you? What she's looking for is leadership that is not there. to have given the right advice and the correct advice so that this event would not have occurred. Now, here's what I find interesting. A lot of the correct advice and a lot of the right advice, and a lot of the expertise that could be so needed and so used in West Africa, I found it this week. I found it here. I found it with your experience in dealing with the coronavirus, because you have that experience. If you take nothing else from my talk, if you take nothing else from the time that I've had to spend with you, as you develop your lessons, please share. One of the things that's not happening in West Africa now, and I said this 2 weeks ago at the conference, is we're not sharing the lessons. There are 49 new healthcare facilities that have been created in West Africa to treat Ebola victims. None of them can talk to each other. None of them are sharing their own lessons learned. None of them are sharing what's working. None of them are sharing what's not working. There are 49 silos somehow treating care. This young lady's looking for good advice, and she's not finding it. I would encourage you, I said this, I think, the other day to somebody, as you're developing your centers, be translational in what you do. And by that, what I mean is, as you learn lessons, as you know what works, as you have your expertise, be bold. Be bold in sharing. Thank you very much.
Thank you very much.
Thank you very much for the excellent presentation. The floor is open for discussion. Yes, please.
Thank you for the excellent presentation, Carl. A couple of comments. First, I want to thank Carl because the Kingdom of Saudi Arabia now is leading the first national risk assessment under the leadership of the PME, the Civil Defense, CAX, and other ministries, the Ministry of Finance. And we have the privilege, of course, to be part of this team. And Carl is one of the great thinker and manager in health. And health is a sector that the Kingdom is pioneering in its comprehensive risk assessment. And so I wanted to special thank Carl, which is helping to shift the dialogue toward let's look at the economic cost. Let's quantify the opportunity missed. And I also want to share an anecdote on Ebola and then ask a question to Carl. During the November 2014 spring meetings, annual meetings, which takes place in Washington every year, with about 200 countries participating with large association, with large representation. One taxi association told the taxi drivers, be careful, there's going to be a lot of African dignitaries coming to the World Bank in this week. As a consequence, the perception of risk, the perception of, wow, I'm going to take Ebola home to my kids, caused a complete shutdown of service. So taxi were not picking up anybody around 6 blocks around the World Bank. This is small. It's just one sector losing $1 to $2 million a day because of a director saying, guys, be careful, and might take Ebola home. So I wanted on this, which I found fascinating, powerful, and scary, I wanted to ask Carl to talk a little bit about the perception of risk in the context of health, how it play out, and how it can disrupt sectors, economies, and societies.
As you know, I have a research program in Nairobi, and I'm there fairly frequently, and it's so interesting because when I returned back to my office in Florida, one of the first things my CFO came to me and said, shouldn't you be in quarantine? And I had to get out a map and say, Kenya's over here, Sierra Leone, Liberia are over here. So one of the issues, which is so interesting, and maybe this is unique in the US, but we're geographically challenged. And so we hear Africa, right? And so you believe all of Africa has a problem, when in fact it's a very tiny, small corner of Africa. But the next thing, go beyond that. And that is once there is a perception of a threat, then one of two things happens right now. And I'm going to come back to this suggestion. One is we either over-dramatize the risk and the threat. And that happens, and if you think about it, right, a lot of that is fed by the media. because the media loves to talk about this, you know, everybody's going to die. It sells newspapers, at least for a cycle in time. You know, I find it so interesting, Ebola has been off the newspapers in the U.S., as you know, now for months, but in fact, the third largest bad week was toward the end of February. You wouldn't have found that in any of the newspapers somewhere, but it was the third largest outbreak, you know, weekly outbreak in Ebola since it started. But we have this news feed, and then we intake this, and so half of the public then actually reacts in the wrong direction, right? And so you get the reaction that you get from, you know, from your folks in Washington, which is, you know, anybody coming from Africa is at risk of, you know, bringing Ebola with them, and, you know, everybody's going to get sick and we're all going to die. That's half the population. The other half of the population is equally sort of dangerous, I think, and that's the half now that have quit listening. Because they've said that we've seen so many press articles about this. You know, remember we had the smallpox threat? You remember that? And President Bush had the smallpox vaccine and nobody else got it. You know, and so we have the other half of the public now that, you know, that in fact goes the other way, which is it doesn't matter anything that's in the newspaper we don't believe. We don't buy any of it. And both sides are a problem, because at the end of the day, this is very important. It's very important for here. It's very important for every place. The reason for that is that we have not, in my opinion, this is Carl's opinion, we have not done a good job of gaining the trust of our population. And trust has to be earned. And it's got to be earned over 1,000 microtransactions. And so if I don't trust you in my day-to-day health, then I may not trust you when you're giving me advice about an outbreak. If I don't trust you because you've ignored all my concerns about my chronic disease or other things, then I may not trust you. And so one of the things that's happened, in my opinion, is that there is a huge trust gap in many countries. I'm not suggesting the Kingdom of Saudi Arabia at all in this. But in many countries, there is a huge gap in trust between the governmental officials and the public. And when there's that gap in trust, it means that the public is going to come out with their own impressions. And in many cases now, those impressions are going to come from where? They're going to come from the internet. They're going to come from a chat room. They're going to come from somebody that's either way over on this side, we're all going to die, or way over on this side, it's a plot from someplace. And the truth gets lost. And so one of the things, that was my little scarecrow picture up there, that even in the middle of uncertainty, you have got to use every day, preferably when the sun's out and you don't have an outbreak, every day to say, what can I do to gain the trust of my community so that when I tell them something, they will react in the way I want them to. And we have a huge trust gap in lots of the world right now, including a lot of places that you travel. Thank you for that.
Thank you. In fact, I just want to tell our experience at the University Hospital here in Jeddah during the coronavirus. One of the problems that I faced as a dean, faculty of medicine, a lot of students during the peak of having patients from all over the country with suspected corona, the mothers of their family and their families were saying, we don't want our students to come to the school, to the hospital, because they might get infection and so on. Some of the staff as well said the same, we are scared of coming to the hospital because the media is talking a lot about corona and it's going to be an epidemic and so on. What we did to try to have trust, actually, and even the Minister of Health did that too, we decided to, of course, do the full restriction of the preventative measures that all of us we did. We were very transparent. We told them that any case of coronavirus diagnosed, we will announce it to everybody at the hospital level, and the Minister of Health did the same for the country level. And we've tested almost 700 staff and students whom they presented with flu-like symptoms and so on. And all of them, thank God, were negative when they screened for corona. And when we decided to start, publicizing these information, then we started to gain trust, and everybody are coming without, talking about this issue, being happy. Also, I'd like just to say, being proud of our hospital, that we are the hospital who we discovered the first case of coronavirus in our hospital, in our intensive care unit, which is coming from Camel. The case published in the New England Journal of Medicine was from our hospital. And thank God that, this is the message that, convinced the Minister of Health that, yes, Camels has to be considered as an effective agent, that we have to take care of. So this is just what I want to say about that issue. So if there is any question, Jamil?
Thank you very much for the outstanding talk. Can you guys hear me? So just on the same track, public panic and transparency. How can you really balance it? How much should we say to the public? Is it right to say everything to them, or we can create more panic and we're going to deal with the consequences of that? The second part is...
Take the microphone.
The second part is, you showed us a slide for your model for measuring risks, the insurance risk model. Do you have any published data for these simulation events that you've created? Has it been published before?
Okay, so there are two questions. Let me take it in reverse. Because the model was built for a private company, we did not publish that data. What I would be more than happy to do, though, is share some models with you and also share. Actually, if you look in the proceedings of this event, you'll see an explanation of the model on my slide, the economic model. On the risk model that we built for the life insurance company, because that was a private sector, we actually could not publish that. But if you want to give me a card, I'll be more than happy to explain to you how it works and what we did and the logic behind it. Happy to share that with you at this point. Let me go back to transparency, and I think that's a discussion that you will want to have here. What you will want to do, you do need to be transparent, but it's interesting to me. I think there's a balance, right? There's a balance between what you know and what you believe and what might occur. And I think what you want to do is share with your public, always truthful, transparent with your staff, absolutely, because they're dealing with patients. But you want to share with the public, but if the information with the public is challenging, you want to make sure that you've got recommendations, right? You want to be able to make sure that the public understands what they can do, the steps that they can take to be able to mitigate risk. And to be honest with you, there are probably going to be some things that you may not necessarily share, even though you want to be transparent, simply because you don't know. It's one of the problems that we've got with again, dealing with novel viruses. It took a long time to identify SARS as SARS. In fact, it was misidentified. On several occasions, and then finally a lab sort of correctly identified it. Actually, two labs, one in Hong Kong and one I think in Germany or someplace, finally kind of got it right. So in the early stages of this novel virus, there's a lot you don't know. And so what you really want to do is you want to be transparent with your public, but I urge spending time on developing that message, and I always urge giving the public advice on something that they can do, that's realistic.
The final question, if there is any. Ladies' side? No? I guess with that, would like to thank everybody for staying until this time. Just a few hours before the weekend, I'd like to thank all the organizers for having this wonderful workshop, well organized. The attendance was great. And the subjects were really outstanding. The speakers were outstanding. I really enjoyed the presentations of all of you. And thanks again for Dr. Ayman Fadl for his leadership in having this workshop highly successful. Thank you very much.